नमस्ते बिटिया हमेशा खुश रहो बिटिया A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, and Faculty of Homeopathic Science, Jyoti Vidyapeeth-FHS University, Jaipur. In today's lecture, we are going to discuss about the history taking in case of endocrinal disorders. Whenever a patient of endocrinal disorders is coming to you, how will you take the history of such a patient? Whenever a patient of endocrinal disorder is coming to you, you have to start with the present history. Ask about the present history. In the present history, you have to ask about the chronological order of the symptoms and do their analysis. How the symptoms are occurring in the patient and what is the chronological order, starting from the first appeared symptom to the latest appeared symptom. And then you have to do the analysis of that case. Then we have to check for the onset of the symptoms, their progression and course, how the symptoms had their onset, how they progressed, and what was the course. Check for the full drug history, including the oral contraceptives, pills, and replacement hormonal therapy. So you have to check for the full drug history, including the oral OCPs and the replacement hormonal therapy that the patient has been taking since long. In the past history, you have to check for all the diseases that are occurring since their childhood. Details of the previous pregnancies have to be encountered for. In the case of conception, postpartum hemorrhage, PPH, the previous surgeries, example, thyroidectomy or orchidopexy, history of any radiation to the neck, gonads, and thyroid, the drug treatment that the patient has taken, for example, any kind of chemotherapy or oral contraceptives. In children, ask for the developmental milestones and growth of the patient. So in the past history, you have to inquire about the previous pregnancies. You have to check about the previous surgery, radiation to the neck, drug treatment, and in the children for developmental milestones. In the social history, you have to check for the detail of alcohol intake if the patient is taking any sort of alcohol. Detail of occupation, example, access to drugs, chemicals. The history of the diet, example, salt, iodine, or liquor. You also have to check for the menstrual histories, particularly in the young. So in social history, we have to check for details of alcohol intake, detail of occupation, access to drugs, chemicals, diet, intake of salt, iodine, or liquor, menstrual history, so particularly in the young women. In the family history, you have to inquire for the autoimmune disease if present in their family, endocrinal diseases, or any kind of essential hypertension. You also have to inquire about the history of diabetes mellitus, take the family details of height and weight, the body habitus, hair growth, and age of sexual development. So this was all about history taking. Now, what are the things that you need to inquire in history taking while taking the case of endocrine system? In the next lecture, we are going to discuss about the general physical examination of the patient with endocrine disorders. What are the things that are needed to be checked for? This session is powered by Digital Version 2.0 Jyoti Vidyapeeth University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. We will be meeting in the next lecture tomorrow. So this was all for today. Thank you very much. We have discussed about the history taking today, and we will be meeting with a new lecture tomorrow. Thank you.